The thing that's so interesting here is we talk about healthy lifestyle. How do we get people there? And erectile dysfunction is a huge problem. You published this paper that looked at the effect of aerobic exercise on erectile dysfunction.
Right.
Without medication.
Right. Yes. I mean, realize that healthier people tend to be more sexually active. And this study shows that lifestyle modification, diet, exercise alone, can significantly reverse erectile dysfunction. Reverse. Right? And so that's really important.
Amazing.
That's really important because most people say, just give me the pill. I say, fine, I can give you the pill, but let me tell you something that you can do to actually truly reverse your erectile function. See, remember that ED is a progressive disease. So what happens, if I give a man Viagra today, it works fine, but eventually it's going to stop working. And that patient will then go on to an injectable for penile injections. Eventually that stops working, and then they go on to maybe a penile prosthesis. So there's a spectrum here, right?
How common is that?
So ED affects 52% of men over the age of 40. It's very common. And I think another way to look at this is 40% of men at 40 have erectile dysfunction, 50% at 50, 60 at 60. You live long enough, you're going to get erectile dysfunction. And so, but it's reversible. ED is reversible, and typically with lifestyle modification. If you improve your lifestyle, it significantly improves your erectile function. Most men say, just give me the pill. I say, fine, I'll give you the pill, but you understand that that pill is going to eventually stop working, and we'll have to go to a stronger pill, and then we have to go to a penile implant. And so if you work with me, we can prevent ED from occurring. Remember that ED is the first sign of a heart attack or stroke. That is really important, right? So if a man gets ED today, 15% of them will have a cardiovascular event within 7 years. That is really important. It's not just about sex.
Those are big. Say that again. Those are big numbers.
This is a prostate cancer prevention trial. If a man develops ED today, 15% of them will have a cardiovascular event within 7 years. That's important because ED is the first sign of a heart attack. And there's a mechanism. How can I explain this? The penile arteries are 1 to 2 millimeters. They're very tiny. The coronary arteries are 3 to 4 millimeters. The carotid artery can be 6 millimeters. So remember from physiology, if you get occlusion 50% of an artery, you start seeing end organ damage. So what are you going to occlude first? You occlude the penile artery first, then you occlude the coronary artery, then you occlude the carotid. So ED typically is the first sign that something else is going to happen, right? So that's very important to realize that. So we take ED as a first sign of a cardiovascular event. If a man comes to me and he has ED and 2 cardiovascular risk factors, we send them for a cardiovascular evaluation just to make sure there's not occult cardiovascular disease. And I think that's really important that men out there, particularly young men, if you have ED and there's no other cause, should be thinking, is there something going on with my heart that could be causing this condition?
Do you typically screen, when we think about the blood panels, I know that you get estradiol, testosterone, free testosterone, SHBG, hemoglobin, hematocrit, PSA, I'm assuming you still get a PSA. Do you also look at, say, ApoB?
Absolutely. So ApoB is much better than all the other ones, right? So ApoB, LP(a). Now LP(a) is a non-modifiable risk factor. It is what it is. But ApoB can be modified. Typically, like to keep the ApoB below 100. You can say 130 or 100. But these are great gauges to let you know what is going to happen in terms of a cardiovascular risk. So I like the way you're going with this because I think it's very important to realize that the first sign of a heart attack in men could be his erectile dysfunction. And that's been shown, as I mentioned earlier, 15% will have a heart attack or stroke within 7 years. If a man presents to you with ED and he appears relatively healthy, if it's not psychogenic, you should ask yourself, is this the first sign of cardiovascular disease? And we take it very, very seriously.
Also, there's a whole push for these weight loss drugs. Do you also look at glucose, insulin, hemoglobin A1C? Because what I love about the way you practice and the way you think is it is not just unidimensional.
Yeah.
We're talking about erectile dysfunction, but you have your 4 pillars. You are discussing things on a broader scale and really more holistic.
Right.
The impact of these weight loss drugs, Ozempic, semaglutide, tirzepatide, what are your thoughts on them and how could those affect infertility, sexual function?
So we're studying those right now, and I think it can have a positive effect. So remember, what does fat do? Fat contains something called aromatase. It eats up the testosterone and converts it into estrogen. So the more fat cells you have, the less testosterone you have, the more estrogen you have. So basically, we like to look at these levels. Losing weight, I believe, will help with fertility. I think it will make a big difference. I think losing weight will help with sexual function. And so we have a trial right now looking at that, giving these medications like semaglutide to reduce the fat to see if I see improvements in fertility and sexual function. I think it's going to make a difference. Let's be honest. Health, it's survival of the fittest. Darwinism. Healthier people tend to be more fertile, right? So healthier people tend to be more fertile. I want you to think of this in two ways. There's two ways to play this. There's offense and defense, right?
Love it.
Offense and defense. And when you talk about offense, I say, okay, I'm going to focus on the 4 pillars: diet, exercise, sleep, and stress reduction. I'm going to do things to improve my body. But defense is looking at what we call the 4 henchmen. I got this from Peter Attia. Looking at if something bad's going to happen, it's either going to be cardiovascular disease, it's going to be either the diabetes metabolic syndrome, it could be a cancer, right? Or it could be neurodegenerative, right? Those are the other ways that can get you. So we do something very silly. We wait till we get the problem, and then we treat it.
I know.
I say, I have a heart attack, and now I'm going to go ahead and figure out how I'm going to improve my cardiovascular health, right? I'm going to wait till I get diabetes, and then I'm going to try to improve my diabetes. No, the name of the game is prevention. So prevention on the over here on these, and then also on this side, trying to go offense and defense at the same time. Very important. And so we go hard on the patients. We look at cardiovascular risk. We look at ApoB. We look at Lp(a). We look at their cholesterol levels. I look at ApoE for neurodegenerative, so you can look at
Wonderful.
that as well, right? You can look at insulin levels in these patients. So we go very hard on cancer screens as well. I like using the Grail as well. It helps me understand what else this patient could have.
Yeah, I was. We had lunch the other day. My husband was there. It was great. We were talking about what you were doing in your practice. You mentioned the Grail,
Yeah.
Which is fantastic, and also scans, whether it was a Pernova scan or CT.
Yeah.
You are the first urologist that I've ever heard doing this.
I think it's important, right? Because the name of the game is prevention, right? If I can catch something today, why wouldn't I? I would only do what I do for myself. So a scan, so you can get an MRI full body scan, although it's sometimes hard to get. You can get a CAT scan, but some type of imaging. Again, this is not standard of care. It's something that I think I offer my patients.
It's progressive, and it's, as you say, offense.
It's offense, right? I want to know what's going on before it happens, right? And I think that that's very important. So we use the Grail as well. I think it's very helpful to tell it's 50 cancers that you may be missing that you can't pick up today. So these are all things I can do for cancer prevention, right? So focusing on the cancer, the cardiovascular, the metabolic, the neurodegenerative, those are the 4 categories. Because again, if you are going to die, those are the 4 ways that can get you besides having a car wreck or a plane crash. But these are the 4. If you know that, you would go heavy on those 4 and preventing those 4 from happening, right? And that to me is more the defense. Find a way to prevent. The offense is diet, exercise, sleep, and stress reduction. And when you put it together, you got a great program.